Even though experts say children are most likely to have a mild case of the coronavirus, research shows that there are some exceptions with side effects for young kids. 10 Tampa Bay reporter Liz Crawford talked to a Sarasota family whose baby tested positive for the virus. His only symptom? A massive rash.
It breaks my heart that he's got it.
First it was dad, then mom, and now baby.
It feels so horrible because I know there was no way of preventing it, of him getting it, because he's only 6 months and I take care of him majority of the time.
Jessica says 6-month-old David is an easy baby, always happy. Jessica took David to the ER last week when a rash appeared on his torso.
And she kind of like freaked out. She's like, Mom, you got to look at this.
He tested positive for COVID-19.
Everything came out clear, thank goodness, but it's just this rash and it's like, it's crazy.
But Jessica is still worried the rash could be a sign of something more serious.
If the baby develops any other symptoms, respiratory, gastrointestinal, unexplained fussiness, and other symptoms, then you have to kind of put it together and say, okay, we may need to take the next step and do some testing.
Some research shows a possible link between coronavirus in children and Kawasaki disease and multisystem inflammatory syndrome, conditions that cause inflammation in blood vessels and other organs. Persistent fever is the biggest indicator of those diseases.
A rash alone and the baby otherwise looks great, is probably okay for now, but then needs close follow-up.
Jessica shared her experience on Facebook, hoping to alert other parents about how different the coronavirus can present in children.
The problem we run into constantly is how much we don't know about the virus. Only time will tell.
Happy baby.
Oh my God, so darn cute. And really, there is so much we're learning about this virus, which is why data helps. And those trends suggest kids aren't as prone to getting this virus. Look at how COVID-19 has spread by age group since the start of this pandemic. Florida's population there on the left, you can see Florida's COVID-19 cases in the orange here. A majority of people ages 45 to 74 make up our population, but the group that's had COVID-19 the most, 25 to 34. That's those millennials. Nearly 19,000 of the 103,000 cases are from that age group. Now, those people are less likely to be impacted like our elderly population. I want to take this chart full so you can see it in its entirety. By comparison, look at the deaths in the state by age group. Only 1% of our 3,237 Florida residents who have passed have been those millennials. 85% of those dying from this virus are age 65 or older.